When you're thinking about management in type 2 diabetes, I think it's rather different from type 1 diabetes, where obviously the thing to do is to start insulin straight away. I think the emphasis to the family and to the patient has to be on achieving a significant amount of weight loss, probably in the first 6 months, certainly within the first 12 months. If people ask me how much, well, probably about 10% of their body weight over the first year. We know from adult studies like the direct study, which actually put people on low calorie diets very early on, that you can actually gain actual remission with that. And so consequently, I think the emphasis has to be on weight loss, and that has to be through dietary changes. You can't exercise your weight down. You have to use dietary manipulation. I do think there's a place for metformin. It's an insulin sensitizing agent, and it doesn't make people really put on weight. If anything, it makes people put on a bit less weight because it tends to cause a bit of tummy upset in the first few weeks, which will go away if you can persist. But I think the emphasis has to be on not starting insulin early, and probably not starting insulin unless you really have trouble with control. And if you were to ask me what I would prefer to use, I prefer to use a GLP-1 agonist after metformin if we weren't achieving good control and good weight loss, because GLP-1 agonists will improve blood sugar control and they will actually reduce appetite. So consequently, that's helpful. Whereas insulin just tends to make people put on weight, and that's really not what you want to achieve in type 2 diabetes. So the emphasis should be on significant amount of weight loss through dietary manipulation, probably start some metformin, and then as a backup, I would use a GLP-1 agonist and only use insulin if control is really poor, having tried everything else. And I think it's really important to emphasize it is a very different condition and we need to think very differently.